The two guidelines are tightly linked because home parental nutrition is the primary and life-saving treatment of chronic intestinal failure. In 2023, the chronic intestinal failure guidelines were updated. The first edition was in 2016, and the most important news are the classification and definition of chronic intestinal failure, especially the classification of the severity of chronic intestinal failure, based on the type and the volume of parenteral nutrition required by the patient. And this classification was provided thanks to the chronic intestinal failure database of Espen. That is a project started in 2015 and allowed us to carry out a prospective study that allowed to validate these criteria of severity classification. Other news included in the updated version are new information about the use of GLP-2 analogs in patients with sore bowel syndrome, and new chapters are the chronic intercutaneous fistulas, treatment of patients with chronic intestinal failure during pregnancy and breastfeeding, the transferring of patients from the pediatric to the adult centers, economics of chronic intestinal failure, and center organization for chronic intestinal failure. Concerning the HPN guidelines, they were issued firstly in 2020, and they were dedicated to the appropriateness and safety of the patients, to provide appropriate and safe standard of care for HPN. And the development of this project ended this year with the devising of the operational recommendation for implementing the HPN standard of care according to the expert guidelines. These are very important issues because aim to provide the centers tools to implement home parental nutrition programs in an homogeneous modality in order to avoid what is the current treatment that is based on non-homogeneous modality of providing HPN, and this causes inequity of access of patients to a safe and appropriate treatment. We know that concerning HPN, the provision of the access of patients to HPN is not guaranteed in all the countries. In some countries there is no possibility to have HPN. In other countries, all the patients who are in need of HPN receive the treatment. But also when we have countries where all the patients receive the treatment, there is no homogeneous provision of the therapy inside the country, and so, as said, put the patients at different risk of complication of the treatment. Concerning chronic intestinal failure, also we know that it is a rare disease, because the epidemiology is of 20 to 80 patients with chronic intestinal failure per million of inhabitants, depending on the country. And this rarity make the patients make difficult to have specialized centers. We have 1, 2, 3 expert centers per country, and we, as Espen, set up recently a paper that is the quality of care recommendation for chronic intestinal failure patients. This was a project devised by the Home Artificial Nutrition and Chronic Intestinal Failure Special Interest Group of Espen. Through a Delphi process, experts around the world were invited to classify the recommendation for process, outcome, and structure of chronic intestinal failure center as mandatory or recommended. And this paper would help those who are in charge to treat chronic intestinal failure to homogenize their standard of care. Monitoring the center activity is an important issue because it allows a continuous audit of the activity in order to improve their own quality of care. And to monitor the activity, recording of clinical outcome of the patients is necessary, and having a database for recording this outcome is the tool for the monitoring. And participating in the chronic intestinal failure database of Espen would help any center to have monitoring its own activity and to have a benchmarking of their own activity versus the other centers. The chronic intestinal failure database of Espen is nowadays the largest database in the world. It started the activity in 2015. At the end of 2023, there were more than 16,000 of patients recorded in the database from around 35 countries in the world. And this database allowed Espen to devise studies, observational studies, and analyzing the outcome of the patients, and allowed to devise the clinical classification, the severity classification of chronic intestinal failure, as well as to evaluate the non-homogeneity modality of provision HPN to patients with chronic intestinal failure.